This is Dr. G and welcome to ICU Confidential. Today we're going to be talking about what a PET CT is. What is a PET CT? No, PET or Positive Emission Tomography Scan is a special kind of nuclear medicine test. And what it does is it looks for areas in your body that are particularly inflamed. We take radiolabeled sugar. This part is safe. It's a very low dose, so we're told. And we inject it into the bloodstream. We give it a chance to circulate, and we use a special tool called a gamma camera that helps us identify any areas in the body where that sugar accumulates. So if you have a bunch of cells and they're particularly hungrier than their neighbors, for example, cancer cells, cells fighting infection, or cells that are inflamed for autoimmune reasons, they're going to light up on the PET scan. The PET scan is not perfect. There are slow-growing cancers, for example, where the cells are not that much hungrier than their neighbors. They're not going to show up on a PET scan. And if you have a spot on the lung or the liver or somewhere else, it has to be at least 8 to 10 millimeters to be able to show up on a PET scan. A PET scan is very fuzzy, and so you get an overlay CAT scan of the body as well. The resolution of the CAT scan is not great to keep the radiation exposure down, but what the CAT scan does is it gives a roadmap to the fuzzy PET scan so you know what you're looking at. PET CTs can also be used to assess heart function and for certain brain disorders. PET scans are rarely done for inpatients, including in the intensive care unit, but as always, there are exceptions. If it's going to make a huge difference in your care plan, a PET CT may be appropriate even when you're in the hospital. If you have more questions about PET CTs, please ask your medical professional. Do not get your medical advice from social media. This is Dr. G, and welcome to ICU Confidential.